If I was to describe the healthcare sector that we work in 3 words, I'd say complex, challenging and rewarding.
Engaged, fast, energetic.
Collaborative, proactive and transparent.
The NHS is a national treasure, as we know.
The NHS is a vital national service and we want to be able to do our bit for the country.
A number of hospitals aren't fit for purpose, whether that be through the patient pathways or the staff using those hospitals.
Well, we want to bring our healthcare expertise to our customers. What we also want to do is understand the individuals involved in each project on a personal level, build trusting relationships.
It's a rewarding place to be, knowing that you're delivering schemes that help the local community. I'm Will Walkington and I am the healthcare sector lead.
Our focus on sector leadership and expertise is pretty straightforward. Having leadership who know the ins and outs of health is critical to unlock conversations and allows us to make quick decisions with confidence.
The company now is 170 years old, very financially sound. We've turned over £60 million in the healthcare sector, right from the South Coast up to the Midlands.
Our ambition here is to be the partner that all of our clients think about first.
In the healthcare sector, we want to live our interiors values and we want to have honest and open conversations with our customers.
We run a very trusting relationship with our clients.
Build an immediate relationship with our customers and deliver a seamless offering.
We get to know the trust themselves, but also the individuals.
We sustain our relationships by delivering good quality projects.
University Hospitals Sussex is one of the key customers we've had in this sector. To date, we've produced around 9 projects for them, upwards of £40 million.
It's a complex working environment where we have to engage with clinicians, nurses, patients. Understanding what they want from that refurbishment or build is super important to a successful project.
The pre-construction phase is where we set the foundations for a successful delivery.
We like to get in early with the trust that we work with.
Gives the customer the benefit of real-world buildability, cost certainty and a robust programme.
Dealing with customers openly and honestly from an early stage, knowing who to talk to when a problem does come up, means that we can mitigate it early.
We can test clinical adjacencies, optimise phasing strategies around supporting business as usual for the hospitals and mitigating risks much earlier.
This just gives us a great relationship throughout so that we can all thrive and build a successful project.
What's particularly attractive to health trusts is the routes to market that we can offer.
We can get involved early and use our expertise to guide a project from the very early stages. We can do this through public frameworks like Pagabo, Scape, Procurement Hub and P23.
We understand that there's often lots of competing drivers for healthcare projects. That's why we bring on our design team early in the process.
Our design approach allows flexibility for our customers.
We have an in-house interior design team that brings with it a huge amount of benefits for what it is we are doing on a day-to-day basis.
We want to be recognised as being the expert in the room.
We've built strong relationships with our design partners who have all the expert knowledge of how to design safe, compliant healthcare projects.
Consistency and collaboration is something that's at the core of what our interior design business offers. You deal with the same people all the way through, and that knowledge from start to finish is embedded in the team.
We can design for adaptability, future technology advancements, as well as sustainability.
Sustainability has been part of the Wilmot Dixon DNA since the company was founded. We listen to our clients very closely in terms of their needs and expectations, whether that is around the communities within which we're operating or their needs around their buildings. From a healthcare point of view, I think the social impact we deliver is really, really important.
We use the NHS social value model to identify key drivers. We've come up with some really bespoke social value delivery drivers, ones that support the frontline staff.
We can help the NHS become more energy efficient and thereby helping them to save costs, while at the same time helping with their staff health and well-being and the community legacy as well.
Our supply chain partners are critical.
We work with quite a small supply chain as we value what they bring to the service.
We create really deep relationships with our supply chain that's based on performance in terms of quality, health and safety and expectation.
Improving that collaboration allows for us to price things faster for our customers, deliver on site faster and plan more efficiently and effectively for our customers.
The key challenges in healthcare refurbishment schemes are working within live environments.
This is such a unique environment. They'll see a very professional, controlled environment. Being in live buildings, it's really key that we have this professional approach. We always make sure that things like noise, disruption and dust are kept to an absolute minimum because it's so important in these clinical environments.
How we get around those is being honest in our conversations, forward planning as best we can, using our expertise and building on our knowledge and using that knowledge.
If our customer knows that we're in control of the site, it enables us to all spend our time looking forward and looking to the more important things.
We're 100% committed to delivering environments that improve patient care.
Our focuses are being excellent in everything we do and actually delivering on our promises.
Healthcare projects align perfectly with our wider vision to deliver spaces that change people's lives.
I'm really passionate about facilitating and strengthening the link between clinical needs, good design and construction delivery.
This business is a people business, and I think it's great that so many people here want to help the communities that we work in.
When we all work together on a complex scheme and deliver a good, successful project, it's very rewarding.
The best part is seeing the clinicians' faces when you hand over a project. The light in their eyes is hard to beat.
We understand the customer, understand their requirements. That leaves us perfectly positioned now to keep on delivering in this sector.